everyone. We are live today from Sakra World Hospital, Bangalore. Here we have with us our expert Dr. Jhansi Lakshmi, a consultant OBG and Gynec, to discuss all your queries on myths and facts about ovarian cyst. Hello ma'am. Good afternoon doctor.
Good afternoon.
Welcome to our live program.
Thank you.
Doctor, here are a few questions from our viewers. What are ovarian cysts?
Ovarian cysts, like any other cysts, these are fluid-filled sacs that may contain a fluid or sometimes semi-solid or a solid material that arise from one or both the ovaries in women. So most of the time, these ovarian cysts may be present in any woman of the reproductive age groups, and any woman may undergo having the ovarian cysts during her lifetime period. The risk is around 8 to 10% in any woman's life.
Okay. What are causes of ovarian cysts?
As I said, it's a cyst. These are very common in the reproductive age groups. Ovulation itself is one of the cause for normal ovarian cysts, which are called as functional ovarian cysts. Apart from this, women may have some infections in her pelvis that is called as pelvic inflammatory disease that may also lead to ovarian cysts. And along with this, other causes are endometriosis or the PCOS, which many people are getting feared of. Actually, these PCOS are not cysts, but they are the entrapped follicles in the ovaries that appear as cysts. And everyone fears of the term called malignancy, which occurs due to alterations of the cells. That also may lead to the ovarian cysts.
Okay, doctor. How are they diagnosed?
Normally, as I said, these are functional cysts are very common, and patients may not have any symptoms regarding the ovarian cysts. In that case, only the routine health checkup can diagnose the ovarian cysts. Sometimes patient may present to a doctor with some symptoms of fullness of the abdomen or the pain. In such scenarios, the ultrasound can be a useful tool in diagnosing ovarian cysts, and once it is diagnosed, further evaluation can be done by MRI, CT of the abdomen, pelvis, and certain Doppler flow studies can be done. Also, there are certain tumor markers which are the blood investigations that help us in determining what type of ovarian cysts there are.
Doctor, there are few beliefs in people regarding ovarian cysts. Let us see they are myths or facts.
Yes.
Ovarian cysts always cause abdominal pain, painful cycle, menstrual irregularities.
No, this is a myth. Most of the time, ovarian cysts may be just asymptomatic. That is, as I said, the functional cysts can be asymptomatic, which are non-problematic cysts. But even other cysts, until they become too large, patient may not have any symptoms. They may be just like normal. They may feel that they have some abdominal bloating, which they correlate with a gastritis and just leave apart. So it's only a myth that ovarian cyst is always going to cause symptom. Until unless they are very large, they may not be posing any symptoms.
Are cysts seen only in old age?
No. Cysts are very common in the reproductive age group, but they are also seen right from the puberty till the old age. So right from a woman's child, sometimes even the newborn babies can also have these ovarian cysts.
Okay. All ovarian cysts require surgery?
No, again this is a myth, because the functional cyst, they just require some observation time period, and sometimes they may be requiring just the medicines. With giving medicines for 2 or 3 months, they may completely vanish off. Certain cysts may require lifetime treatment, and the cysts which are very large, which are causing symptoms, only will require the surgery.
Is surgery includes removal of ovary?
Again, this is a myth, because ovarian cysts are removed as a cyst itself. The ovaries are most of the time left behind if there is no pathology in the ovaries. So cysts are only removed but not the ovaries.
Okay. Large cysts need open surgery?
Again, this is a myth, because most of the ovarian cysts are benign. It's only 1% chance of the ovarian cysts to be malignant, and as long as the cyst is a benign, they can be operated laparoscopically only. You don't require an open surgery for benign cysts.
Can cysts recurrent or unavoidable?
Certain cysts do recur, like endometriotic cysts and the polycystic ovaries, but these can be controlled by lifestyle changes and with the medications available nowadays. This is only a myth that cysts are always going to recur. Only few cysts have the chance of recurrence that can be taken care of.
Okay. PCOS always cause ovarian cysts.
As I said, PCOS is only thought as ovarian cysts, but these are not actual cysts. These are the entrapped follicles that look like cysts, multiple cysts in the ovaries. In fact, these are not at all ovarian cysts. These are just happening because of the hormonal imbalance.
All ovarian cysts cause infertility.
No, all ovarian cysts don't cause infertility except endometriosis and the PCOS. And in those also, there are treatments available. Early intervention and early management can prevent the infertility. Some people also believe that if a person is having ovarian cyst during the pregnancy, that will also lead to miscarriage, which is also again a myth, as most of the cysts are asymptomatic even during the pregnancy and they will be requiring treatment only if they become symptomatic due to torsion or the rupture, which can be easily managed even during the pregnancy also.
Okay. All ovarian cysts are cancerous.
No, this is the biggest myth which every people believe, that once an ovarian cyst, then it's definitely cancer. No, it's not. As I said, any woman of reproductive age can have ovarian cysts during their lifetime. That ranges from 8 to 10%. Of all those cysts, most of them are functional cysts. And of all other cysts, only there is a chance of 1% in the ovarian cyst to have malignancy. That also usually happens if the cysts are happening in the puberty age or in the postmenopausal or close to the menopausal age. Only then the chances of cancerous part increases. Otherwise, most of the time the ovarian cysts are benign, which can be taken care of.
My last question is to summarize, how are ovarian cysts are treated?
The functional cysts, they only need observation for 2 to 3 months. They disappear after you again do a scan. Normally the repeat scan is advised to do after the menstruation has stopped. And these doesn't require any treatment. Few other cysts, they will require hormonal therapy, maybe for 2 to 3 months. Certain conditions like endometriosis may be requiring a little more than the hormonal therapy, may go up to the injections part until unless it's a very severe grade 1. And the cysts which are growing, they are of a big size, causing symptoms like abdominal pain, bloating sensation, irregular menstrualities, or any urinary symptoms or obstructing with the bowel movements and all, they will be requiring a laparoscopic surgery. And coming to the ovarian malignancy, they are done open surgery after proper evaluation, because open surgery is only recommended in malignancy because of the risk of the spillage of the cancerous cells. To summarize, these are the few treatment options available.
Okay. So thank you for this awareness ovarian system. So with this, we come to an end of today's live show. Thank you, doctor, for your valuable insight. Thank you, viewers, for joining us. If you have any queries, you can leave a comment and our expert will answer them for you. Thank you, doctor.
Thank you.